morning, everyone. Welcome to Superior Health Quality Alliance. This is our introduction to structured collaboratives and ECHO. I'm Barb Link, and today my coworker Elena Smith and I will be giving you an in-depth overview of our structured collaborative intervention that we're using to implement our quality improvement efforts through our CMS contract. So Elena, you want to go to the next slide? So our objectives for today are to understand the Superior Health Structured Collaborative Implementation Strategy, receive an introduction to the ECHO model. This is one component of our structured collaborative intervention, and it is a very specific modality to implement an all learning, all sharing intervention to community and quality improvement. And then learn about opportunities to enroll in some of our upcoming structured collaborative education opportunities that we have coming up in December and January. Okay, thanks. Next slide. So many of you have heard a bit about our tiered approach to quality improvement in our CMS contract. Our approach is a three-tiered approach to achieve our 5 broad goals that we have for the coming years. I'll go into just a brief overview of our independent and affinity group approach, but mainly focus on our structured collaborative approach today. So, how this works is that we are trying to meet your needs wherever your learning is at. So we understand that there are quite a few different healthcare quality improvement efforts that we're trying to work on, as well as you are. And some of those you might have a very strong grasp of, and some of those you might feel that you need more of an intensive approach to really implement those at your organization, within your system, or even when you want to do a broad reach into a community. So what we're trying to show is that there's flexibility, ability to move wherever you're at. So for example, they build upon each other. Our independent approach is for the advanced learner. We have action guides that are very similar to what you might be familiar with a toolkit, but they're a little bit more extensive than that, in that on a particular topic, they will have components to it such as checklists, connections to websites, tools, and information that you can use if you feel that you can independently just enhance the work that you're already doing. Then when we move more into an affinity structure, that's more, I would say, for your intermediate learner. So you can take the tools from the action guides in the independent approach, build on it if you like, but also through our affinity approach, you'll have opportunities to attend webinars more that you're used to, say it's on a specific topic. For me, I'm most comfortable talking about, say, our sepsis training that we've had in the past. We'll have an expert on how they've introduced sepsis protocols and information, do a webinar on it, and you can take away the tools and information from that webinar and introduce them into your organization. Also, through our affinity approach, over time, we'll be having groups of people who are interested, say they feel that they have a solid foundation in understanding sepsis, but they want to exchange ideas. They're having challenges with other people who are about at the same learning level. They'll get together, kind of think of it in my past life when I was a clinical social worker, where we'd have groups get together and they would be sort of a self-help group. So everyone would come, share ideas, learn from each other, and then could go back to their own environment and implement those things. So it's a little bit less formal, but still sharing of ideas with your peers. Then today, we're going to talk quite a bit about our structured collaborative. Our structured collaborative is our most intensive approach. I would say that that is for maybe a beginning learner or somebody who feels that maybe they have advanced knowledge in different areas, but in a particular area, say sepsis, it's sort of new to them, and they really want intensive information on that particular topic so they can bring that back to their organization. This approach has the most support with it, and it builds on the other approaches. So if you're in a structured collaborative, that certainly you can take advantage of the action guides that are supplied through the independent approach. You can attend webinars in the affinity group, but through the structured collaborative, it's a very specific, more intensive learning opportunity for people who really want to learn the most and take tools back to their organization. And then there's quite a bit of sharing, tracking, and monitoring for improvement in this particular approach. All right, Elena, let's go on to the next slide. So again, just to reiterate, it's the highest level of technical assistance. There's cohorts for structured learning through this, through the tele-echo approach, which Elena will do a deep dive into how that particular approach works, as well as I'll be going over the virtual training as another modality for learning in the structured collaborative approach. And it also, both of those different types of training will provide for a large amount of sharing and networking as well. Elena? Okay. So why would someone want to join a structured collaborative? We want people to have a solid knowledge of that when you walk away from this webinar today. So the reasons why you would join is because you would be able to collaborate with healthcare organizations within your, not only within your state, but also with other states within our region. So as most of you know, we are currently working with the states of Michigan, and EMPRO, the Quality Improvement Organization, is the in that state. In Wisconsin with Metastar, and in Minnesota with Stratus Health. And so currently you have the opportunity to expand your knowledge through things that are going on regionally as well, which I always think is a very exciting opportunity for people. There will always be a short didactic session, even in the virtual training modality, as well as the ECHO, where you'll be learning specific interventions and information specific to the topic that you'll be attending. And there's always time for sharing and networking afterwards in each session. The way that we'll do that with the two different sessions, a little bit different, and we'll go into that as well. So you'll also have access to Superior Health staff for a large scale improvement. And I see that as being not only that you can take this very specific tools and information that you've learned on a particular session, on a particular topic, back to your organization, but you can take it back to, say, your system-wide improvements, as well as something near and dear to my heart, community collaboration and working through your community as well through the continuum of care. Because as we all know, many times it's a need for a systemic approach to really improve quality of care for the patients that we're working with. And so we also have the opportunity, which is very unique, that Elena and I have gone through training in the ECHO intervention, and it's very exciting. It's a very specific way of learning and making things actionable on the specific topics that we will be implementing throughout the structured collaborative. Okay. So on this slide, I thought it would be helpful just to have a side-by-side comparison. These are two learning opportunities within the structured collaborative that we'll be providing for people. Again, I think it's also very exciting because you are enrolled in our initiatives. All of this is free to you. And so it's really a great way to learn and provide information back to your organization and the community that you work in. So again, Elena will be providing the tele-echo structure, but I thought it would be helpful. I will go into some of the specifics on the virtual training just a little different. A lot of things are the same, as you can see here when you compare the two, but the virtual training is a little bit more what people might be familiar with. So again, I tend to like to use examples. Within Michigan, we did implement a sepsis screening protocol and training for people. And this will follow, if people are familiar with that, it'll follow very, very much the same sort of structure. So the frequency can be variable. It could be weekly sessions that people are attending, bi-weekly, or even monthly. Typically, it can range from 6 to 16 sessions, depending on what the learners need and the information that will be provided. When I think of most of our virtual training that we've done in the past, they do tend to be on the shorter side, more around 6 to 8 sessions for people, and tend to be a little bit more on a monthly basis. And that's simply because many times, as you can see, as we move along the continuum, what the session would include is some homework and coaching calls in between. I'll go into that in just a second. So people will be familiar to this type of virtual training a little bit more than, say, the ECHO structure, simply because it's more of what you're used to, like a classroom style. There's someone who is an expert in the field who's providing information and education on a specific topic. And then from that, providing an overview of the tools that you'll be using. But within this training structure too, there will always be opportunity. Within our sepsis program, we called it a round robin session. And that's where each individual attending that particular session talked about successes, challenges, lessons learned from the previous session. And then other participants could then say, oh, I had that exact same challenge. This is how I talked to leadership about it and worked it through. Maybe you want to try that technique too. So it's very much give and take and supporting of people who are peers of yours to learn and bring back that information. So then the next component of it is the homework approach as well as coaching calls. Many times with the virtual training sessions in between the current session and the next session, people will have homework. Say they'll talk about how to introduce a sepsis screening protocol within your system, and how do you even write the policy for that, procedure for it, and how would you talk to leadership to get buy-in. All of those would be your homework for the week. And then you'd come back at the next session, say about 4 weeks later, and talk about, did it even happen? Did you have time to do it? Why didn't you have time to do it? Somebody who did have time to do it, what did they do? And how could you use those techniques moving forward? And coaching, sometimes you just get stuck. And so the person who's the facilitator for the training would reach out and set up a specific call just to talk to you. I know some people feel more comfortable reaching out for assistance. Some people just need that extra touch. And so we would be having the facilitator reach out in between the sessions to talk you through some things just to see how it's going. And so we can keep moving the information along. And then through this, typically there are process measures we're evaluating through the virtual training. So we introduce sepsis screening, and then at the end of the session, then we are providing you information on how to, say, collect data on how many screenings took place. Of those screenings, how many were completed appropriately, and then what did you do as an intervention if you saw, say, low numbers of completion or low numbers of accuracy, and then what can you do? And so the coaching calls would help with that as well. And then many times we're using data to drive improvement. So we're looking at readmission rates regarding sepsis and different quality indicators along those lines. So we can see, did this virtual training really help within the people, the group of people who were trained versus maybe some people who weren't trained, and that sort of thing for quality improvement. So, and I see a couple questions coming up in chat. I could entertain those now. Elena, were there a few questions that I could address right now?
Yeah, I'm actually not seeing them, Barb, so go for it.
Maybe they're coming to me individually. Oh, they are. It says many centers have had an entire shift in their resident populations between short stay and long stay. Are there collaboratives around care for long stay residents at SNFs? And would the sepsis data collection mirror the MPRO Tri-County measure and its related data tool, or another level or population? All great questions. And what we're trying to do right now, we have some set educational opportunities, but all of those things, actually at the end of today's session, we want to hear from you. And so all of those things certainly could be future topics and adjustments. We want to work in the real-time environment that everyone is dealing with now. And so some of those things have been the way that we have implemented our sepsis training here in Michigan, but we want to make it more accessible and flexible for what you're seeing in your work environment right now. So we want that information from you. We are still doing our organizational assessment, which will be coming out soon for people to complete. Again, that will be another opportunity for people to give us feedback as to what they're needing in their learning environment. But we can certainly, Kim, thanks for asking all those questions. We can take that information back and tailor our sessions with the information that you're wondering about too. So currently we might introduce it as to the structure that we have currently, very similar to what we've been doing in the past, like you said, with our measures around our Tri-County Collaborative here in Michigan, and see how it's working. Is it relevant for people? And then adjust it as need be. We always want to live by plan, do, study, act in our environment too. So that's something that we're running to look at. Hope I'm answering your question. If not, please let me know. Okay. All right. And so with that, I think I'll move on to Elena with the information on how an ECHO is structured.
Thanks, Barb. Yes. Hi, everyone. My name is Elena Smith, and I am a quality improvement advisor with Superior Health Quality Alliance. And I'm going to be going into depth about the introduction to the ECHO project. And actually, I encourage all of you, if you have other ideas throughout this whole presentation that come to you as we're explaining all of these things, that you think might be a nice educational opportunity that we could kind of create for all of you, please let us know. You can put that information into the chat and we will review that after this presentation is over. So to get us started, what is Project ECHO? Have any of you participated in an ECHO before? If you have, feel free to type that into the chat and let us know. ECHO stands for the Extension for Community Healthcare Outcomes. It is a hub and spoke model for knowledge sharing to create learning loops. These learning loops demonopolize knowledge and amplify the capacity to provide best practice care for underserved people all over the world. The information that you learn by participating in a tele-ECHO assists you in providing the right care in the right place at the right time. There are 4 main principles of the ECHO model: utilizing technology to leverage scarce resources. In this case, we utilize the Zoom platform since it's user-friendly and doesn't require your organization to purchase any licenses or equipment. The next principle is sharing best practices to reduce disparities. This will be done through our didactic presentations, but we also want to hear from you and what your recommendations are during the case presentations. Another principle is applying case-based learning to master complexity. You will not only be hearing from us, but also your peers to see what real-life scenarios are occurring as you implement change within your organization. And lastly, evaluating and monitoring outcomes. We'll be tracking your progress as you participate in our programs to determine if these platforms have been successful. When all of these principles are applied, a learning community where there is an all teach, all learn mentality comes together. Our sessions together will always encompass these 3 principles: a didactic presentation from your Superior Health Hub team that will provide you with evidence-based practices based on the session topic for the day. Along with that, we'll always have a case presentation from yourself or a peer discussing a situation you would like to bring for recommendations to the group, and discussion from your peers in the Hub team on recommendations for your case and any other questions the group may have. We want you and your peers to get the most out of each session, so be prepared to share a case presentation during our time together and share your experiences and recommendations with others when they are presenting their case. Just to go into a little bit more detail than what's all shown here, another aspect of each echo is that at the beginning of each echo, we'll ask you to introduce yourself. So that's just another way to network with others and learn who is joining you on each echo session. As I mentioned, we'll have a case presentation during each echo session. This is kind of an example of what it might look like. So you can see here, it's 2 pages long, or front and back 1 page. Every time you might not need to fill out all of the information. It kind of does follow that plan, do, study, act format, but some of the questions may not be applicable to what you're trying to present. Another thing I want to mention with these is that you're not always going to present a specific case. You may present on a topic or a process rather than a specific case. But this is just kind of the general template for what we might use. Some of the questions might change depending on what the topic is, but this is what you could expect if you are going to present a case for us. What we would do is we would display this up on the screen with all of the information that you sent to us, and you would just be able to kind of read through it for your case presentation and then ask for any recommendations from the group. Now to get into some echo etiquette. So the things we always want to make sure that we're doing when we have an echo. We always want to ask you to put your name, organization, and email in the chat box so that there is that form of networking available. We always ask that you keep your microphone muted when you're not speaking because it helps cut down on extra background noise. We ask that you communicate clearly during the session and identify yourself verbally each time for those that may just be on the phone. If you do have the availability of a webcam or a video, please turn that on if you're able to, because it just creates more a collaborative learning atmosphere. As when you can see others on the call, you tend to share more and make those recommendations and just foster more of that network. We ask that you always speak clearly and in a conversational tone, and then excuse yourself and turn off your camera if you need to walk to a different location, have a side conversation, or take a phone call. On the flip side, we never want you to disclose any protected health information or PHI. So for example, with those case presentations, if you are going to be an upcoming case presenter, we'll ask that you just send your case presentation over to our team first, so we can just double check that it doesn't contain any PHI before giving you the go-ahead to present. We ask that you never criticize a person's ideas, engage in side conversations, or make extraneous noise like typing on a keyboard or rustling papers, especially if you're not on mute, because those conference microphones are very sensitive. And then finally, we ask that you never talk over any other people. If someone is speaking, let them finish or signal your wish to talk to the facilitator. And I'll give you a couple ideas of how you could make that signal. Within Zoom, there are some great features that you might not know about already. The first one is the raise your hand feature, which I'll be showing you exactly where that is. That's a great way to signal to someone that you have something that you want to mention. You can always use the chat box. You can either chat to everyone or someone privately. And then finally, you have the option to rename your square with your name or agency/location, which I will get into as well. So just some quick Zoom basics. This is the Zoom window, which you kind of should be seeing right now, outside of the fact that I am sharing a screen. So you'll use the black toolbar at the bottom of your screen for navigation and Zoom features. However, it may disappear if you are not hovered over it. You can join audio or open the chat box from this toolbar. This is how you will mute and unmute yourself by clicking the microphone/phone icon. When you're muted, you'll see that red line through it. If you're not muted, you will not. We will have areas that we would like you to participate either via audio by unmuting or the chat box. So we always ask that you have that availability or the ability in general to be able to unmute yourself. So there is a way that if your computer does not have a microphone that you can call in. Each of our invitations should have that call-in number available. so that you can call in and use a telephone if your computer does not have that microphone capability. What I'm showing right now is the participants window. So this is a great way to see who all is on the call. Some of these features like the mute all and unmute all, that's really only available to the host to be able to do that. So you may not see that, but you should see a list of all the participants. I mentioned a little earlier of some of those signals. The first one I want to go over is the raise and lower hand. That again is in that participants window, and it should be showing down at the bottom of that where you can see that raise hand or lower hand. It's a great way to signal to us that you would like to speak up. The next thing is the chat window. So if you do want to enter in a chat, which I see we have some coming in right now, you can either signal to write it to everyone, or you can see that that is a drop-down box where you can search for a specific participant's name and just chat directly to them. We do ask that if you do have just a general question, feel free to chat that to everyone because other people might have the same exact question that you do. And that is all I wanted to go over. Quick Zoom basics. The other thing that I didn't get into as detailed was that renaming feature, which I'm not sure if everyone's aware of. But when you do hover over your picture over in the thumbnail or your name, if you don't have your video on, you'll see that there's either an option to unmute or there's 3 dots. If you click on those 3 dots, you're actually going to be able to go down to the 3rd option. At least that's what it is for me. And there's an option to rename. So we always ask, that's another great way to make sure that we know who's on the call with us, is if you rename yourself and also add in which organization you are from. In addition to that, I think there was something else I wanted to mention with the renaming. We highly encourage everyone to join us on all of our educational opportunities, but if someone does forward you a calendar invitation rather than you registering yourself, if you open up that Zoom link, it will show your name as that person that forwarded you that calendar invitation. That's totally fine. Now you know that you can just rename yourself so that if Betty sent you the invitation to the event and you clicked on her link and it's showing that you're Betty, but you're really Phil, we won't call you Betty and we'll call you Phil. So please let us know who you are by renaming yourself using those 3 dots and then clicking rename. And with that, I just want to open, before we get into what our upcoming events are, I just want to open it up to any questions that anyone might have about what we've gone over so far. Seeing some topic ideas in the Zoom group chat. Some ideas about some focus areas on readmission reduction programs, including disease states. I think that's a great idea. We'll definitely bring that back to our team. You see that Janelle mentioned that there's an echo for palliative care out there. I'm not seeing any other participants that have joined other echoes. But we have done them in the past. They're a really exciting opportunity, again, because we are using this regional approach. You might be able to connect with some health systems or some nursing homes or clinics that are similar to your own that are just in other states to kind of learn from each other or within your own state.
And also, Chris, if you have some ideas, I know some of the things that we've done in the past is actually use data to drive the specific disease topic that we might focus on. So one time in our last scope of work, we looked at, through our Medicare fee-for-service claims data, the top 10 readmission diagnosis. And so that's where our sepsis program came from. We're looking at a CHF program right now. So if you have other ideas or things that you're seeing in your particular organization, that would be very helpful for us to know too, if there's a targeted topic that you'd like.
Thanks, Barb. Well, feel free to continue adding questions into the chat or any statements. Again, we really want to hear from you. If you have any other topic ideas, feel free to keep throwing those into the chat and we'll bring them back to our full team. But with that, we do want to go into what our upcoming educational opportunities are. And so I will pass it back over to Barb.
Thank you, Elena. Thanks so much. And it was great information on ECHO. It's a great learning opportunity. And thanks. I think that was very helpful, the framework that you presented. So we are starting out with our structured collaboratives with 2 topics coming up right away. Again, want to really reiterate, when we say fundamentals for a culture of continuous improvement, our structured collaborative, we're talking about intro learners, beginning learners. So if you're more of an advanced learner in quality improvement or even an intermediate learner, this may be some of the things that we're going to talk about may seem very basic or things that you've heard before. So we are happy to have any type of learner attend our structured collaborative, but we really want to help people understand that the structured collaborative strategy is really introductory level. So with that, we thought we would move into our implementation phase of our contract with doing some very fundamental concepts of quality improvement within an organizational structure. So some of the topics we'll be talking about is what are qualities for great leadership within an organization to introduce a culture of continuous quality improvement, how to establish a good quality improvement team, and then communication. Great communication strategies to continuously have that culture interwoven within your organization, your system, as well as your community, and then constantly looking at how do you retain that kind of culture for your organization? How do you get sustainability? And how does it just become rote? How does everybody within your organization start feeling comfortable to have that continuous quality improvement culture within your organization, systems that you work with, or even within the community that you work with? So that's sort of our philosophy for that. And we're very excited. It's starting actually next Tuesday, December the 1st. And so we have a very strong participation already, good registration. We do not want to have too many people within these structured collaboratives. So we have the ability to do the didactic, have the case presentation, and have that all sharing kind of environment. So space is limited, but that is coming up, and that will be for 6 sessions every Tuesday thereafter. We are skipping December 29th because that's in between the main holiday week. But other than that, it will be consecutive weekly sessions for that. So I believe, Elena, did you put that in the chat to register?
I did, yes.
Okay. So we are still taking participation and registration for that, but it is filling up. I have to say I was a little surprised, but we're very excited about that. Okay. All right. And so we are also accepting case presentations for that. So if you are interested, you could even submit a case and are registered. Once you receive your registration confirmation, we can give you that template and you can fill that in if there's an issue that you're having around quality improvement within your organization and want to get that out there. The other thing is it doesn't have to necessarily, I think Elena might have mentioned this, but it doesn't have to necessarily go alongside with the topic for the day. It could be a different topic, even outside of what we're presenting, if you're having that kind of challenge at your organization or want to have some feedback on that. So just so you know that as well. And again, always remember, we don't want any patient-specific or PHI information contained in that. And that's why we like to see it beforehand, just to do a double check and make sure that that's not on there. And as you can see, you can send that on to Elena if you like. And If you have any other questions, you certainly can contact Elena, or you can contact me. I think both of our emails are at the end of the presentation, but if not, I'm blink@mpro.org. Can put that in chat. If you have any other questions or want to submit a case presentation for our upcoming culture of continuous improvement. Yep, that's me. If you say it quickly, it's Blink. Okay, now the other ECHO opportunity that we have coming up following the fundamentals for a culture of continuous improvement, we will then, I see it as an expansion of a similar theme. So we have then our leadership, organizing, and action structured collaborative. That is taking community organization principles and using them in a healthcare environment. It's a very exciting and interactive way of developing a community coalition that's healthcare in focus and uses, as everyone knows, patients do not live in one particular organization as a silo onto themselves. It's very important to understand in this day and age of the continuum of care and how to work together to provide the utmost quality of care for the patients that we serve. And so this particular intervention really focuses on looking at how to establish a positive community coalition within your area and strategies to engage the right type of leadership for that coalition, how to think about who are the proper partners for your particular coalition, and how to make action plans for continuous quality improvement within a community setting. So we're very excited to be able to offer this as well. That starts on January the 19th and continues through February 23rd, again, following that structure that Elena put forward regarding the ECHO model. And you can do both of these opportunities together as a continuum to build off each other, or you could do them separately. So there's 3 ways you can look at this. You could just register for the fundamentals of a culture of continuous improvement, our first learning opportunity, and then be done. Or you can just register for leadership, organizing, and action if you think that that is an area where you would really like to improve on regarding healthcare-focused community coalitions. You can just register for that one. Or if you feel that you would benefit from learning about QI principles from the fundamental of the culture of continuous improvement, and then you want to move into the LOA or leadership, organizing, and action ECHO, you certainly can do that too. Currently, you would have to register for both individually, but you can seamlessly then go into the next opportunity. So there's 3 ways you can do it. You can register for each class and just take them individually if you feel like that topic is just what you're interested in, or you could take both if you want to build on the learning that you had from the QI principles and then move forward from there. So those are our first 2 opportunities. We thought we would start with the basics. Thought it was a good time to just reintroduce some things that maybe people know about, maybe they don't. And then we'll move into a little bit more specific information, say maybe setting specific, topic specific, as Chris mentions, disease specific, whatever we're finding out your needs are, that's how we'll start moving forward with our structured collaborative, our independent approach and action guides, the content for those, as well as developing and forming some of those affinity groups that we talked about earlier in this presentation. So we really want to hear from you. We have a formal organizational assessment going out, but we know that sometimes when you're filling in a questionnaire or an assessment, it doesn't always get at everything that you're thinking about. Or maybe at a different time you go, oh my goodness, I forgot to write that into that organizational assessment that I remember they asked me to complete. We're always happy to have you reach out to us and give us your ideas, your thoughts, what you see real time in your organization. We want to develop our initiatives around your needs. So there's my email and there's Elena's. Please reach out to us if you think of anything afterwards, that you have any questions, concerns, issues registering, or topics that you'd like to discuss. And anything you're seeing in chat, Elena, that people are wondering about? Or
I don't see anything in chat right now, but I also can encourage anyone, if you have a more detailed question that's a little difficult to type out, feel free to unmute yourself. If you are joined by phone, you can unmute yourself by pressing *6. If you're joined by computer, you can kind of hover over your name and you should be able to unmute that way as well. So feel free to let us know if you have any questions, any topic ideas, or anything like that. I'm going to leave it on this slide just in case anyone wants to write down our email addresses, in case you think of anything in the near future that you want to shoot over to us.
I did see someone chat in pain management, which I think is a great topic, could cross over into even our behavioral health initiative as well.
Yeah. I did get one chat too, if the slides will be available from today's learning. Yes, absolutely. We'll make sure the slides are available. Actually, I think I have them right now. I can put them in the chat. Just grab them quickly. We also recorded this call for any of those participants who were not able to join us and who plan to take one of our ECHO opportunities in the future, just so they know what ECHO is and what to expect with that. So this is recorded. It will be up on our YouTube page within the next week or two. And I added the PDF to the slides within the chat if anyone would like to have those right now. I also see a falls reduction topic. I think we have kind of something like that on our horizon, but we'll definitely push that and find the correct people that will be able to speak to that. And just so you know, Barb and I will not be leading every single structured collaborative. We will be leading the first one that starts next week, but you'll definitely see some other familiar faces in future educational opportunities.
Not seeing any other questions in chat. I guess we can close out the session, but we truly appreciate your participation today and want that continued feedback and information from you. So please, if you think of something afterwards, chat it in. Oh, and Darlene just chatted in reducing readmissions regarding medication management. It's a great topic. Great. All right.
I'm writing them all down, so.
You're making our job easier. Thank you so much. Okay.
Great. Thank you everyone for joining us today.